I'm Ashley Marceaux, and I am a BCBA with Butterfly Effects. Today, we're going to be doing a brief overview of the term telehealth and how to best prepare yourself for these services. The definition of telehealth is the distribution of health-related services and information via electronic information and telecommunication technologies. It's a really big mouthful, and really what it means and how it is meaningful for us is that we are going to start utilizing video and audio platforms to provide long-distance training and supervision. We get a lot of questions about what that will look like, and that's a really great question. Ultimately, the BCBA will be providing supervision and caregiver training in the same manner, except they are using that audio/visual platform to view session or to view you. We also encounter some questions about how to maximize the success of your telehealth services, which is really great to start thinking about. We want to make sure that everyone is well prepared before they start using telehealth, before sessions or before caregiver training. So we go back to basics when it comes to technology. We want to make sure that all of our devices are sufficiently charged, or that they're plugged in during session or during the caregiver training so that your battery doesn't run out. We want to make sure that there are smooth transitions, and that that is one less thing that you would have to worry about. We also suggest that you check your internet connections throughout the day if you can. So if your internet is going in and out during the day, you may want to touch base with your BCBA prior to the scheduled session and just let them know that you're having internet issues and that it's been going in and out. Could certainly move forward with trying, but if there are any bumps in the road, you can definitely move that supervision or that caregiver training to a different day while your internet issues are resolved. The next point is to set up a session in a place with minimal distractions in the home. Now is a time where we have friends, our family members, our siblings that are all in the home with us together, even though we're practicing social distancing as much as possible. Now is a time where we may have our family members staying with us. And so we definitely want to make sure that family members and siblings can certainly be a part of any session, and we can definitely plan for that and arrange for that. However, we do want to make sure that we are setting up in a place where it may be a little bit more quiet so that the BCBA can hear the instructions that the technician is giving to your child, or the responses in conversation that your child is having with the technician. So it's just really important that the BCBA is able to visually see everything that's happening, and then also able to hear everything within the session. It's also a really great idea, once the video/audio platform is sent to you and shared with you, to spend a little bit of time reviewing that platform. So just run through it, click some buttons, you're not going to hurt anything, and get to know that platform before your scheduled session. That way you don't feel stressed when the time comes to know how to answer the phone call or hang up the phone call or switch screens if you need to. And so it's just always a great, opportunity before session, maybe 10 minutes, to just run through, scan through that platform to make sure that you feel comfortable. We also just want to touch on unanticipated behaviors. So sometimes they occur, and that is fine. We are well equipped to handle those situations with you and support you through that and support the technician. It's always a great idea to make sure that you're touching base with the BCBA prior to the session to let them know, hey, my child seems to have a difficult day today. We may see some behaviors that we don't normally see. Just wanted to prepare you. And then that way the BCBA can have a tentative plan on how to work with you and the technician through these behaviors if they were to occur. So it's just always good to have a plan A and a plan B and make sure that all bases are covered prior to session. We definitely still want to have you involved as much as you're able to. So plan certain times to come into session and participate. So if there's a program or if there's a behavior that you need help, teaching your child, please make sure that you're reaching out to your BCBA and saying, hey, I would really like to pop in for a couple minutes, after they do table time to work on my child gaining my attention. And that's beautiful. We definitely want to continue to do that and see you involved in session and support you. It's also really great for you to come in prior to the end of session so that your BCBA can still debrief you on the events of session and how things went and all the wonderful things that your child has done, and to make sure that you don't have any questions or concerns that have yet to be answered. Additionally, with you being involved in this session, if there are siblings in the home and you feel like you would like them to be involved in certain aspects, so if it's social goals that we need to work on and it's turn taking or it's having conversations with their peers or their siblings, we certainly want to make sure that we continue to work on these goals with you. And so just make sure that you're speaking to your BCBA prior to session so that all of this can be planned out ahead of time. And so it's a smooth transition for your child and for the technician. How to get started. This is the exciting part. When you decide that you are interested in services, if your BCBA has not already reached out to you, definitely let them know that you are ready to move and groove with telehealth services. What will happen next is we are going to gain your consent to use telehealth. We are going to send you the platform that we can use to do telehealth between you and your BCBA. And then we set up your first session, and it's as easy as that. Then we get you going, and you'll see how wonderful telehealth truly is. We're so lucky that we live in a day where we get to utilize these really amazing technologies so that we can continue to bring you really effective and meaningful services, support you, collaborate with you, and hopefully continue to provide really great environments for your children as well. Thank you. I hope you have a wonderful day. And